Oh, you want a videotape? Go ahead, you already started.
Okay. And then when you measure like the widest part of the wound?
Yep.
Okay. So then you start, oh wow, it's like pretty much the same. Okay.
So this is also a baby, so it's hard to even
7.5, 7.5?
But there also looks like there is some tunneling here, so you would be measuring, an adult you'd be measuring that. This is a baby, so it's all very deep. A big wound.
Yeah.
Do you see how it like is
Kinda like-
deeper than the rest?
Yeah.
So on like a bigger wound, you can see on the big butt, see how there's like that big tunneling and the undermining underneath, that stuff would be measured as well.
So what did we have so far? We had 7.5 in diameter.
7.5 7 in length, 7.5 in width, and then right now we're going on depth, which is like probably here would be the deepest, maybe, because like this doesn't look super deep, or this looks deeper.
That looks like it's tunneling in, but then this looks like it's just like.
Yeah, we'll call this a tunneling then, and then this the.
I mean, we can probably measure both because it might as well be as descriptive as possible.
Okay, so I'm seeing about this deep, which is like.
So would that be the
Like 2 centimeters.
So maybe that's
superior of the wounds? Because if they're, or no, how would you do it?
We would call it the 12. Well, the clock would be for the tunneling. But this, I think we just say the depth. So like the deepest part is 2 centimeters.
Okay.
Yeah.
And then
the tunneling
is like
It's hard. You guys got the teeniest little.
here.
Not very deep.
Okay, so I see 1 centimeter.
Yeah.
Which is like 7 o'clock at 7 o'clock. Is that how we say it? 1 centimeter at 7 o'clock.
Well, tunneling at 7 o'clock. Depth, yeah, 1 centimeter.
Okay.
Oh, we have to write the tunneling at the.
Oh
At
yeah.
the time.
Yeah.
And if it's. Yeah.
Because it's like 12 o'clock, right? Okay.
And if it was
Okay,
like,
so the 2 centimeters at 12.
So the depth part is there's a 2 centimeters here,
Okay.
but then the tunneling here was
Like
1.
7?
Yeah, depth was 1 centimeter.
Okay.
Okay, so this turned out to be deeper.
there you go.
Okay, and then would it be at this point that we would do like the
Yep, if you're all done with your assessment, another thing you can do on your assessment is do percentages of how much of that is the granulation tissue, like the red
this
puffy
part?
tissue, versus if you see anything else. You can like write that as an assessment as a percentage wise.
Oh, okay.
I don't know what you call that, maybe like 75% granulation tissue. And then
Okay.
saying if you see anything else in your written
Yeah,
assessment.
75% granulation, and then
So that's like this pinkish part. That's the red puffy healing tissue.
this
All this
this
good,
part.
all this good. Oh,
Red
all this
puffy
as well.
tissue.
Okay.
This
is all the granulation.
Oh, okay.
Like good stuff. So this and
Okay, so this part, yeah, it looks like 75%. And then would we talk about like seeing the fatty tissue?
yep.
Fatty
Any
tissue.
percentage or whatever you're seeing. I don't even know if that's anything deep in the tunneling or if that's just dirt. But.
Oh,
Well,
yeah.
it's just dirty. But maybe, yeah. And then you can say a percentage. I mean, if you're giving it 75%, then you can say the rest, like 25% is just some kind of fatty tissue
25% fatty tissue.
or whatever you guys think.
Yeah, I feel like it might just be dirt in there.
I think
It could be dirt.
Yeah, these are used a lot.
Yeah. dirty wounds. Okay.
So 25% fatty tissue.
Around there? Yeah, it's kind of a lot. Okay, and then for something like this, where it's like a pretty deep wound, would you want to do like the wet to dry, like you pack it? Yes.
See, I was curious about the two ones. You can like do those strips. So
So you just do your best.
Okay. And then do these. Oh, no,
So I mean, obviously this isn't a very big wound. It's a baby. It's probably only gonna take
here we go.
like 2 gauze.
yeah. Okay. Would we just use one of these rolls, or do we just use these?
I mean, I would use these. And
Yeah.
You can, I mean,
Wet them.
yeah. I don't know if sure. Yeah.
And then once you're done with that, you
Oh, okay. Yeah. This makes sense.
have an ED pad, you'll
So
put
it's
that
like.
over there,
Have to be.
and then you'll
Oh, we have to like
use some
dump
skin
out.
tape to go ahead and tape it.
So for this part, putting it in, you can use your sterile forceps
And
and
that
your
will
sterile
basically be
Q-tip.
your wet to dry dressing.
Oh, there's
Okay.
already. Oh, I
So
didn't
this
realize.
one.
Is
So typically, I know you guys are just practicing too.
Yeah.
You want different gloves, and then when you're doing your assessment and taking everything out, and then you're gonna put sterile gloves and try to keep it sterile procedure going in.
Because this is non-sterile. Or wait, why?
Because now these are like
Yeah, now they're contaminated.
Now
yeah.
they wouldn't be good technically.
Yeah.
So you would have fresh gloves to do your assessment and everything, and then you would go sterile packing.
okay, and then try to
Just
touch
like
the
you would
wound
any
as
sterile
little as
procedure.
possible. Okay, that makes sense.
So what is this white stuff in there? That would be the.
Fatty tissue.
I'm assuming that's fatty tissue, unless that's a bone right there. Well, I don't know. I was thinking maybe it's coccyx.
Like it's so shiny. I feel like it might be.
It's hard to tell in the dummies.
Do you know how there's
know.
like two different shades? Like, how would you like call it like this shade of red and the
So that's just more redness, I think, around the wound versus like the actual open wound stuff. That's the puffy red tissue. That's the granulation tissue.
Okay. Trying my best here.
I thought the white stuff was like pus. I mean, the like curling, that looks like the, what's it called? Pibbling, the rolling of the skin around it. And if you did have a deeper tunnel, you always want to get your tunneling and your undermining first. Like
Oh yeah,
you would use
yeah.
packing for that, but that's not big enough.
Yeah.
It's just a little one, but okay.
Okay, makes sense. Things are like making sense a little
You're
bit.
doing good. You guys are doing great.
Okay, should we pack another one on there, or should we just go?
I
with
would
the
do
dry?
one more.
Okay.
You want to make sure that wet gauze is touching all around that wet granulated tissue. It's touching all the
Okay.
sides of the wound.
Okay.
When you take it out, it's going to help like get all the dead stuff on the way out.
Okay, and then if I were to use this Q-tip for the first packing, would I want to use a second Q-tip, or does it
I
matter?
mean, as long as you're not touching it to anything else and it's still sterile,
Okay.
you're only touching, you know,
Okay.
the gauze, putting it in, you're good.
Okay,
But
sounds
usually it comes with you. You can always, if you're never sure, better to be
extra safe.
safe than sorry. Yeah.
Yeah.
No shame in the room.
Do you usually hear patients complaining though when you're doing the wound care part?
To be honest, in the hospital, we don't do a lot of wound care. There's like wound care nurses.
Oh
It
yeah.
hurts.
Oh, I bet.
was
And it's a
thinking about
baby.
that.
The baby's probably
When
crying.
they're doing the assessment, it does not feel good. They're like poking, sometimes taking, you know.
Yeah.
Yeah.
I cussed at my nurse when they did the wound care.
But patient care, if you know you're going to do wound care,
Yeah,
don't
you know
wanna
they're gonna-
give them their pain medication before.
Yeah, that's true.
Yeah.
And I
Harder,
guess
not harder, make
you
your
would
life
also
easier,
write
so you're
that.
not getting yelled at.
You would also write that in the thing saying like they.
Yeah, patient complained of pain, or like in this case, our baby's
anytime,
crying.
Yeah, anytime you're documenting, you want to document, you know, how they tolerated the procedure. They were like yelling at me the whole time.
Patient said, "Eh,"
Yeah,
in quotes, right?
pretty much. But that's what's good to usually give. I mean, typically, wound care orders are super, super specific, which is why wound care nurses do it typically.
It's like a
They give you
specialty.
the doctors give you very specific orders.
Uh-huh.
Okay. Unless it's like a really basic, small wound. But like big wounds, like the people in like the surgical unit that I have that have like, you know, just spine surgery or like really gnarly cellulitis or whatever. I'm not doing it.
That's not for me.
Okay, well, they don't want me. Yeah. Wound care.
Better to do 2?
Yeah.
And just kind of, I mean, it kind of goes over the baby, but let's assume that there's more baby to cover.
Yeah.
And then, would you want to use, is this the ABD?
Yep. So that's what you're sticking over it. At this point, they're covered. Your sterility's over. You're good.
Okay, so for this one, does that matter what side is? There's like a blue line here. No? Okay.
It does not go on your sterile field. It's non-sterile.
Oh well, yeah. And then we use the saline.
Or would this just have to be like over here?
Your saline's not on your sterile field. You're fine. Show them at the bottle.
Oh, this
Oh,
bottle?
maybe she meant.
Oh, it makes you the actual bottle of saline? Yeah.
Yeah, no, it's not there.
There's not a lot of baby, but it's okay.
My highest functioning group takes the most unambitious patient.
We went with the unique one. We weren't actually going for easier.
Just like interesting.
Yeah.
Roll my eyeballs now.
Also, like, you would have been a baby, so it would have been technically a lot harder because you would have been crying. And that would have been
I wonder-
very difficult.
Good recall.
Yeah.
It's called spinning.
Okay. Tape comes off, but
This is so difficult.
What if a curling iron fell on our baby?
Oh my god.
irresponsible mom.
That's like a good one. Like
Yeah.
that could happen.
Or maybe he was playing outside and got up on the tailpipe of the truck.
I mean, there's also like maybe the mom went out. Baby can't turn over. Like mom went out all night, so baby
Yeah,
was.
you never know.
Yeah, you never know.
When I was little, I literally saw like the flat iron, and my mom was using it, and she was on the phone, and I just saw it, and I was like, "Should I give it a high five? I will." And I literally just like.
Oh my
and
god, you
I
remember
heard-
that?
I remember. I was like 5 years old, and I was just like, "That's how I know. Never to touch it."
Okay. Then
Oh, you need to
I need
label.
a.
Oh, I'm not here. Will you
Yeah.
hand that service? Oh, your pin. It's not like it's there.
You're
can you
good
write it for
on
her?
your sterility's over. They're
Okay.
fully covered. You're
Oh, thank you.
yeah. Once they're fully covered, you're good to go.
Where's the end of this?
Great question.
Oh my gosh, am I blind?
Go ahead.
Oh no, I see it. Okay, so we put our initials.
So once the wound is protected, the sterilization is over. It's safe.
Yeah,
We're
it's
good.
fully covered. Once
Today-
you put that
Okay.
pad and the gauze on, you're not touching it.
Is the 12th. What time is it?
It
It's
is 8:21.
0821. Is that it? Initials, date, time?
Oh, or initials. Yeah.
Yeah? Okay. Okay. I feel like the stress comes with like making like
Like preparing everything.
preparing it and then making sure you're being like sterile and then like wondering if you covered all your bases and stuff.
Yeah.
Yeah. Yay! I guess that's it.